Hi, I'm Dr. Gilmer and we're here today with Ariel Duvall from the Mammoth Orthopedic Institute. We're going to review your postoperative sling use and go over some tips and pointers to ensure the proper fit. The most common sling configuration looks like this. If you've had a rotator cuff repair or biceps tendon surgery, the sling will be fitted to you postoperatively in the recovery room or as you're leaving surgery. In general, you won't need to adjust any of the Velcro straps and will only need to utilize the quick clips to take your sling on and off.
So when you're wearing the sling, like Dr. Gilmer said, you shouldn't really have to adjust any of the straps on here. The pillow should be comfortably at your side and slightly in the front of your body. Your elbows should sit all the way back in the sling and you should feel like your forearm is supported. You want to be able to stand and have this snug at your neck but not pulling on it so you don't feel like your arm is dangling at your side. And the strap here should again be nice and snug but not so snug that you feel like it's squeezing you. So next I'm going to show you how to put the sling on yourself or with the assistance of someone else. Now keep in mind, if you have a rotator cuff repair, you don't want to actively use the muscles in your arm to move your arm to put it into the sling. Also, if you had a biceps tenodesis, you aren't allowed to use the muscles in your arm to flex your elbow, so you will need to use your other hand to help flex the elbow. So what I'm going to have you do here, Kimmy, is I'm going to have you take your arm with your unaffected arm and just kind of hold it a little bit away from your body. Okay, then we're going to slide your hand in first, nice and slow, and we're going to make sure that your elbow is tucked into the back of the sling here. Okay. This strap comes forward and supports the forearm. And then this one, there we go. This one comes around here and clips in this way. This clips in here. So this would be a way to do this in your first couple days after surgery if you need a little bit of assistance. Next, I'm going to show you when you get a little bit more mobile how you can do this yourself. So after your first couple days of surgery, when you're feeling a little bit more comfortable with taking off your sling and putting it back on, you should be able to do this yourself. My suggestion would be if you place your sling on a counter or a tabletop, then your sling will be supported and you don't have to hold it up. So what you're going to do is you're going to take your unaffected arm to hold your affected arm, and then you're going to slide that into the sling and it's supported on the table here. Then I can just take this and wrap it around my neck and take this and clip it in here, kind of holding with my fingers. Again, you want the pillow a little bit in the front of your body versus back here. Now you'll also notice you may get some swelling pooling down into your forearm or your hand, and that's what this ball is for. If you take this ball out, you can just work on some gentle squeezing, either in the sling or out of the sling. You can do this. Make sure that you keep it away from your dog at home if you have a dog.
The other common configuration for postoperative sling is most commonly used with labral repair surgery or slap repair surgery. In this type of sling, a larger abduction pillow is used to create more distance from the shoulder to relieve tension on the repair.
So if you find yourself in this sling, the fit will be very similar to the other sling that we previously showed you. However, sometimes this part on the arm is a little bit too low and you won't feel like your arm's supported. If that's the case, your doctor or your therapist, we can help you adjust this higher. You should make sure that your elbow is sitting back nicely in the armrest of the sling and that you feel like your forearm is supported.
Regardless of what type of shoulder surgery you have, you're encouraged to remove the sling 2 to 3 times a day, and using your unaffected arm as a helper, move your elbow, wrist, and hand in order to decrease postoperative swelling.
Remember that you shouldn't have to adjust very much on the sling. If you have questions, ask your doctor or physical therapist. It's imperative that you keep the pillow, whichever one you were issued after surgery, under your arm, and you do not remove that, as that creates optimal position for healing for those tendons or the labrum.
Thanks for watching.